Hello, everybody, and welcome to this session on the muscles of the pelvic girdle and the hip joint. There's a few more muscles in this one than there have been in some of the other sessions, so gird your loins and let's get going. It's not that bad once we start, honestly. Okay, so let's start by looking at a muscle called iliacus. Now, you can see from the picture that it covers the inside of the iliac fossa. And the iliac fossa is just that curved inner surface of the pelvic bone, hence the name. So it starts up on the inside of the ilium and then descends down to insert near the top of the femur. And this is where we get the word iliopsoas, which often when we're talking about the hip flexors, we say about the iliopsoas, because this actually merges with the psoas tendon, which is the next hip flexor we'll be looking at, to form the sort of combined muscle group, hip flexor iliopsoas. Crosses the hip, and its action is to flex the hip. So that's iliacus or iliacus, depending on how you like to pronounce it. So here's the other part of that muscle group, and it's called psoas major. And you can see it's quite a different shape to iliacus. It's a long muscle that actually starts at the transverse processes. Those are the bits that stick out at the side, and the discs of all the lumbar vertebrae. And if you remember, there are 5 lumbar vertebrae, and also right up to T12, which is your lowest thoracic vertebrae. So that's 6 of your bottom vertebrae it connects onto, the transverse processes each side, and then goes down to attach into the top of the tendon where, as we said before, it shares, top of the femur where it shares its tendon with iliacus to form the iliopsoas muscle. So it crosses here not only the hip, but also the intervertebral joints of the lumbar vertebrae. So this is a really deep muscle. It's one of the paraspinal muscles as well. And because of where it is, it plays a really important part in back health because it's attached to all of those vertebrae. And it really helps to stabilize the lumbar spine. So it has a role of stabilization, hip flexion, along with iliacus. And if the legs are fixed, then it pulls the trunk up to it. So the back is the origin, the legs is the insertion. So in standing, say, where you've got your origin fixed, it acts on the insertion to flex the hip, and then when you're lying down, it acts on the origin to bring the trunk up, like in a sit-up position. It also works unilaterally as well as bilaterally in lateral flexion of the trunk. Next, we've got a very long muscle called sartorius. And you can see it's a long, thin, kind of almost S-shaped muscle. And it's in fact the longest muscle in the body. And it covers two joints. So it's a 2-joint muscle. It crosses the hip and it crosses the knee. So it starts at the front and at lateral aspect of the iliac crest, and then kind of curves round to attach on the medial side, the inside of the tibia. Now, its insertion point is actually quite interesting because when you look at some of the other muscles, it has a combined insertion point on the tibia that it shares with gracilis, which is another one we're coming up with, and semitendinosus, which is one of the hamstring muscles. And together, the tendon is called pes anserinus, which kind of mean goosefoot, because those 3 tendons coming together looks like a goosefoot. So we'll hear about that again. So the action of sartorius is to flex and laterally rotate the hip and to flex the knee. And it's sometimes known as the tailor's muscle. So you think about sitting cross-legged, the action you have to bring your leg up into if you're going to sit cross-legged. And this is the action that sartorius does, the tailor muscle. Now, tensor fascia lata is a muscle that lies between the superficial and the deep iliotibial band, your IT band, and that's why you can really only see the top part peeking out the top, because it's sandwiched between those two layers of the ITB. And it's a muscle that works with the glutes, especially glute medius. And it starts right up on the crest of your ilium, inserts into it, merges into the iliotibial band, crossing the hip and knee via the ITB, and it works to flex, abduct, and medially rotate the hip. Now, there's a little rhyme that I learnt a long time ago, and I always remember, which is tensor fascia lata, glute, medius, and min all abduct the femur and rotate it in. So that's how I remember which are the abductors and medial rotators. Tensor fascia lata, glute, medius, and min all abduct the femur and rotate it in. Okay, so we're now on to the glutes, the gluteal group. So there are going to be three we're going to look at: glute maximus, glute medius, and glute minimus. And you can tell by the names, they're obviously different sizes. So let's start with the biggest first. It's the biggest and the strongest muscle in the body, and that's glute maximus. And it covers all the back of the pelvic girdle, and it inserts into sort of the proximal, so the top end of the femur. So it also, going back to the origin, it's also the base of the spine that covers the sacrum and the coccyx. So it's a hip joint. It works on the hip joint, and it's the most powerful extensor we have, and it also laterally rotates. The other thing that it does is to help stabilize the upper body and the pelvis, and it helps during walking or locomotion by ensuring that the pelvis is stabilized. So that's glute maximus, the biggest and most powerful muscle in the body, and a powerful hip extensor that we use functionally in all our walking, climbing stairs, sit to stand, bit of everything. Okay, so that was more posteriorly. If we move now more laterally to look at gluteus medius, have a look at the muscle. So this starts on the outer surface of the ilium. If you remember, iliacus is on the inner surface of the ilium, glute medius on the outer surface. It inserts laterally. It's a very lateral muscle on the top of the femur, crosses the hip. And if you remember our rhyme, it works with tensor fascia lata and glute minimus in weakly abducting the hip, internally rotating it, but in different positions. Because it's quite a broad muscle, different parts of the muscle can do different actions. So the posterior fibers can actually laterally rotate the hip when the hip is flexed. Again, this muscle's really important in hip stabilization during walking to prevent that dipping of the hip down to one side and prevents the knee rolling in, so keeps everything in alignment. Third one we're going to look at, glute minimus. So maximus was the most superficial. Medius is underneath, just partly covered by glute max, and then glute minimus is the smallest of the three, and it's deep to glute medius. Really, it's very similar in function and structure to glute medius. It's just deeper and smaller. So it too starts on the outer surface of the ilium, attaches onto the top of the femur, and works to abduct, internally rotate, and again, posterior fibers kick in to laterally rotate the hip when the hip is flexed. So really, function being the same with medius and minimus. So moving on from our glute muscles, we're now going to look at a really interesting muscle called piriformis. Now, if you do sports massage, you'll hear about this a fair bit because there's a piriformis syndrome that can cause problems with the sciatic nerve. So let's take a look at this. So as you can see, its origin is on the anterior surface of the sacrum, and then it crosses to the top of the femur. It's quite a flat muscle, and it's part of a group of deep gluteal muscles that laterally rotate the hip. So it actually lies almost parallel to the back of glute medius, and it's an interesting one because it can be used to locate the sciatic nerve, as the nerve runs just below it, and if this muscle is tight, it can cause pain down the leg that's called piriformis syndrome. So this one you quite often hear about if you're doing anything to do with sports massage. It can cause quite significant problems. So that's piriformis, one of the deep external rotators. We're going to get three muscles in one here. This is our adductor group. So this group of muscles draws the leg inwards towards the midline. So the three different muscles are called adductor longus, adductor magnus, and adductor brevis. And they're all found in the medial compartment of the thigh and are just known as the adductors. And we tend to talk about them just as a group. So you can probably guess by the name that longus is a large one and large flat one. Brevis is the smallest one down at the bottom, and longus is one of the long ones. Oh, I've said long ones. Magnus is the big one. So they all start from the pubis, and they insert either on the medial or slightly towards the posterior part of the femur. They work on the hip to adduct the hip. So that's longus, magnus, and brevis. That's the adductor group. So I think the rest of the muscles now, we're all looking more onto the medial side of the thigh, and these act together as a group. So this one is called pectineus or pectineus, and it too starts from the pubis, a much smaller muscle, and it assists with the adduction and flexion of the hip. So it's a medial muscle, and it starts from the pubis, inserts into the femur, and works with induction and flexion. It also helps with medial rotation. Gracilis is, I think, the final one that we're going to be looking at, and this is a spiral-shaped muscle on the inner part of the thigh that can be quite prone to injury. So sometimes you might hear about groin strain, and this is often a muscle that's responsible for groin strain. It's actually the most superficial and medial of the adductor group. It originates at the pubis, inserts at the top of the tibia, and it crosses the hip and the knee. Now, this one is part of that pes anserinus group that I mentioned earlier with sartorius. So gracilis and semitendinosus and sartorius all have a common insertion. And the action of gracilis is also, you can tell by its position, it's going to be an adductor, and it helps with knee flexion, assisting with the hamstrings. So there we go. That's your group of your muscles of the hip and the pelvic girdle. Do spend a bit of time going back over them so you can really fix them in your mind. Okay, that's it for now. Thank you.